Good morning, everyone.
Good morning.
My social innovation is a scalable initiative that unites research and practice to reduce incarceration rates. What if you lived in a country that incarcerated more people per capita than anywhere else in the world? You do. The United States out-incarcerates many countries by hundreds. What if you lived in a country that incarcerated people because they were sick, because they were cold, and because they were hungry and had nowhere else to go? You do. There are high rates of homelessness represented in the incarcerated population because jail is often the only option for keeping an individual safe from whether themselves or others. What if you lived in a country where growing numbers of children were more likely to go to prison than to college? You do. In communities disproportionately impacted by incarceration, higher percentages of youth experience prison rather than college. What if you lived in a country where almost every person who was incarcerated was rearrested again shortly after their release? You do. Nearly 77% of people released from prison are rearrested within 5 years because of inadequate community supports. What if you could stop these trends? We can. Our innovative solution, the Concordance Initiative, unites public, private, and academic partners to create, research, and implement the very best practices and policies to reduce incarceration. We address a major driving factor of high incarceration rates: failed reentry of incarcerated individuals to their communities. When formerly incarcerated people fail after prison, more crime is committed. Their families are harmed, their children are at greater risk of dropping out of school and engaging in their own criminal behaviors, and the entire community, our communities, suffer tremendous financial burdens. When formerly incarcerated people do well after prison, they become tax-paying citizens, active members of faith and other civic communities. They have economic mobility, their behavioral and physical health improves, their children do better, and there are no more crimes. Through the Concordance Initiative, we are developing a groundbreaking and sophisticated reentry program model designed to be scaled nationally. We have formed a group of researchers and public and private leaders from all these sectors to create this model. The Concordance Academy is a reentry program that will interrupt the cycle of incarceration. We intend for the Concordance reentry program to also be a prevention program. Prevention of formerly incarcerated individuals returning to prison, prevention of increased risk of incarceration for their children, and prevention of drastic economic drain on communities because of financial costs required to support large prison populations. This model supports people transitioning from prisons to communities and their loved ones in a holistic, comprehensive, and integrated way. The Concordance Academy begins work with incarcerated individuals and their loved ones prior to the individual's release from prison and continues to work with them after their release, developing their education and employment skills, using treatments and services to promote their behavioral health and physical well-being, and building and bridging positive social supports to extend well into the community. The Concordance Institute researched over 4,000 programs from around the world to develop the Concordance model. We examined evidence of highly effective programs with other populations that face similar challenges to those that people who go to prison face. We researched programs delivered to people with substance abuse problems, with mental health problems, people who have experienced homelessness, veterans who return home facing new challenges, and with adults and juveniles in the justice system. Across all of these different populations, we examined and selected the highest quality, the most rigorously evaluated treatments and services. Then we braided those services together to create the Concordance model. The Concordance Initiative also recognizes that current public policies can create substantial barriers to full community participation after prison. Therefore, we are developing simulation and other models to examine existing policies and to generate evidence-driven policy innovations that will promote rather than prohibit people's success after prison. In order to produce a scalable model that can rapidly be adopted into practice nationally, we are working to develop new research methods to allow us to move the scientific discoveries of the Concordance Initiative into practice almost as soon as they occur. Reducing rates of people incarcerated is a pressing and unprecedented social issue. 13 million people experience incarceration each year in the United States. Through the Concordance Initiative, we intend to reverse that trend by drawing on the best available resources from academic, public, and private sectors and providing the country a motto to follow. Thank you.